Dr. Tatiana Zelenova, who has more than 25 years of experience in the medical practice, including 20 years in the fields of cardiology. But wait, what makes Tatiana unique, she comes on up, is that she's not just treating patients. She has successful experience in creating medical centers from scratch and working across borders to ensure that people get the health care they need. Tatiana, thanks for being here.
Thank you, Mayan. Thank you, everybody. I'm really excited to be here and to be surrounded so amazing people. I'm really proud because, you know, we have clear understand what's happening now. And just some few words about myself. I'm medical doctor, I'm cardiologist, and I headed last year's Hadassah Hospital branch in Moscow. It was the first international branch in Moscow. I have great experience in R&D, launched clinical trials units and centers, launched from zero, from scratch, hospitals and international department and university. That's why I have a huge amount of friends all over the world and high expertise medical doctors, professors, etc. So we really, we have to understand that we live now in dramatically changed worlds. And we have to understand we live in, perhaps not in crisis time, but recession. And my opinion, just two direction, medicine and IT technology can break through instruments, tools. Even imagine my experience 25 years from student with phonendoscope. And now imagine as a medical director, as a manager, I have in my hands tools, telemedicine. Last year, imagine numbers, increase 4,000%.
The use of telemedicine, amazing, 4,000%.
American Investigator Center shows 4,000%, 1 million consultation only in USA. Telemedicine, medical information system, artificial intelligence because of big data, teleradiology, teleophthalmology, artificial organs, 3D prints. My colleague Yakov, thank you very much. Very interesting interview because I believe in stem cell therapy. I have already patients who are on such therapy in different phases, and really very interesting time.
So let me ask you this.
Yeah.
You talk about telemedicine, which really means that you don't have to go and physically see the doctor to get the care that you need. So you are doing something that you call medical care without borders. Explain what that really means. What is healthcare without borders?
Medicine for me all the time, and for our company Health Plus, I present here Health Plus company, and our mission is the international marketing arm of Hadassah. Our mission is medicine without board, because it's not only my opinion. For medical doctors, staffs, nurses, medical professors, it's not important for us the nationality, races. It's not important where I am. I like to say it's very important who you are and what are you doing and with whom you are doing. That's why for me it's medicine just a challenge, especially now new words, digital medicine appear, digital healthcare.
Amazing. Now, since the signing of the Abraham Accords, you've been working very hard to sign deals and collaborations between different hospitals in order to allow medicine without borders to take place between different borders, between, for example, the UAE and Israel. There was one hospital I know that you spearheaded with. We talked about Zuleika and Hadassah, but there are others since then. Tell me what you're doing in terms of collaborations across the border between Israel and here.
Thank you very much. Good question, because, you know, since March we have already made and CEO of company, David Berezin. David, thank you very much. When I arrived here first time in my life in December, I thought, my God, they opened the board. It's really a challenge for us. And I met a lot of colleagues, the key opinion leader here, visited hospitals in Abu Dhabi, Cleveland Hospital, Burjet Hospital, Health Point, Mediclinic here. They are very different. It's really interesting. There are the best building, medical technological construction building here. One of the best equipments and instruments, medical equipments. But I think this is not problem of UAE. This is the great challenge all over the world, the lack of staffs, the lack of medical doctors, the lack of nurses, educationable, competent persons. That's why we very quickly changed our business model, and first of all, because the company has great experience like a facilitator, medical tourism, and we decided to bring here and organize the Center of Excellences, the Center of High Expertise, and to organize telehealth center, command control center, and to bring here medical doctors who provide treatment, surgery, provide education programs, R&D, etc.
Amazing. And as you mentioned, it's bringing new technologies, biotech, higher standards to the area. Why is this so important?
It's very important, biotech, very important technology. But I want to notice that's more important, and reporters has already told human capital. Human capital, that's why we have like an association of Israel-based expertise, key opinion leader, European, and we will bring them here. That's why we organize platforms on medical universities and hospitals.
So it's more about bringing the people who can provide the treatments to the places.
Thank you, Maya.
So now recently, in Israel, we had a very challenging security escalation. It was not only the one that most people read about in the headlines between Israel and Hamas in Gaza, but it was also on the streets. There was an outpouring of violence that erupted between Jews and Arabs in our mixed neighborhoods that were historically known for coexistence. And, as the fires flared across Israel, what was so fascinating was the doctors and the nurses offered testimony that coexistence is possible, and they called on Israeli society to learn from what happens in the halls of Israeli hospitals. Many people believe that science and healthcare are the foundation for peace in the Middle East. What do you think?
Exactly right. Because, when it's very important, and a lot of speakers have already told that very important to bring here and to organize education. Bring education, because when the people are educatable, they don't need to fight. It's simple, It's
Amazing. Well, let's hope that that is a great start to the future of more peace and bringing health and science for that purpose. Thank you so much.
Thank you, man. Thank you, everybody.
Thank you.
Thank